findings. This year in 2013, we've so far had published 5 scientific papers in the peer-reviewed literature. And I just wanted to share with you some of the key findings on each of these. We need to get that fixed. Carol, can you fix that on the screen for us? Thank you. So the first of these was published in the MMWR, where we were looking at disparities in breastfeeding and what's happened over the time period 2000 to 2008. And what you see is that whether you're looking at blacks or whites, rates have been going up for initiation, for duration of breastfeeding at both 6 months and at 12 months. But I think what was most important about this finding was that when we look at the gap between blacks and whites at the beginning of the decade, we had 24.4 percentage point difference between whites and blacks. And that gap has narrowed to 16.3 percentage points difference. Of course, we want that to be eliminated to 0 and see no disparities, but we're certainly moving in the right direction in closing that gap. So that's the good news. The bad news of that paper was that when we look at how many women are continuing to breastfeed to 12 months, we've not been able to narrow that gap at all. There's been improvement for both blacks and whites, as we indicated in the previous trend slide, but that gap has just been parallel for both of those. So we need to see much more improvement in the rates among blacks to catch up with where we are with whites and make continued improvements in both of those. Second paper by Heather Clayton was published in Pediatrics using data from the Infant Feeding and Practices Study 2, where she was looking at the timing of introduction of solid foods. And what she demonstrated here was that 40% of kids in the country are being introduced to solids before 4 months of age. So even if you take the AAP's old recommendation at the time that the study was done in the mid-2000s to say 4 to 6 months was the recommended time period, 40% of the nation was introducing solids even earlier than that. What she also pointed out was that among those who were breastfed at the time that they were introduced to solids, those rates were much better, that only 30% or 25% were being introduced to solids early, whereas the much higher percent were being introduced early for those who were formula-fed or mixed-fed. In a study by Erica Odom, also published in Pediatrics, she was looking at reasons for stopping breastfeeding earlier than desired. So what she was looking at was not whether or not women met a goal of 6 months or 12 months duration, but rather just looked at did they breastfeed as long as they wanted to. So among mothers who had stopped breastfeeding at the time of the survey, over half, 60% of them, said that they had stopped earlier than they themselves intended to. And she looked at why that was. And the top reasons really were related to milk flow. Didn't have enough milk, or the breast milk did not satisfy the baby. Other reasons, other top reasons were difficulties with the initiation of breastfeeding and really the kind of support that is needed to getting breastfeeding off to a good start. Trouble getting the milk flow to start was about 29%, baby not having interest in nursing or beginning to wean himself, and the baby having trouble with a suck or a latch are among the top reasons that mothers are saying that they're not breastfeeding as long as they themselves would like to. Another study by Jessica Allen, published in the Journal of Human Lactation, focused on support for employees of the hospital in their own breastfeeding. And what she showed here was that the most common supports that are provided by hospitals are much more related to expression of breast milk. So breaks to express milk, room to express milk, provision of a breast pump are the highest services being provided to hospital employees. On the other hand, when you look at trying to keep the mother and baby together through maternity leave or on-site child care so that she can directly feed her baby, those are much less common services provided to the women in the hospitals. What she also demonstrated was that between 2007 and 2011, whichever of these indicators we look at, they're all moving in the right direction, with the largest improvement being seen in the provision of a room to express breast milk. Clearly not where we want to be as a nation, but we're making significant progress there. And then finally, Kriya Perrine and Kelly Scanlon published a paper in Pediatrics on the use of breast milk in advanced care units, so special care units or NICUs. And what they showed was that in a very short time period, just between 2007 and 2011, the use of breast milk in these advanced care units has gone up dramatically. Use overall for any babies went up from 20% to 30% that were being provided routinely for children in the NICU. And use of donor milk bank, or banked donor milk, went up almost twofold, from 10% to about 22%. So significant changes in the way we're providing breast milk in the advanced care units. With that, I'm going to pass it on to Carol to talk about the state programs.
Hi, everyone. It's been really great that we've been able to provide continuous funding to the states over the last 5 years. We had a cooperative agreement that started in 2008, and it's a 5-year cooperative agreement that just ended in June of this year, 2013. It provided $18 million annually to the states. We were able to fund 25 states to work in the prevention of obesity and other chronic diseases. And the best part for us was that we were able to include breastfeeding as a required strategy that needed to be addressed in the states. And as you can see, the states picked several different areas to work in based on the breastfeeding guide that was put out in 2005 expressly for the purpose of supporting states in picking strategies. As you can see, there were 10 states that worked in maternity care, 13 that worked in employment, 5 that worked in child care, and there were various other programs included, such as providing support for coalitions, for example. Just as 2 examples, I want to talk about 2 states and how they use their funding. So the state of Montana used their funding to establish a program that started leading hospitals towards becoming baby-friendly over time. They took the incremental approach, and they started with the most challenging, most challenging area of the 10 steps, which seems to be, which is educating hospital staff. So they've taken that on, and they have actually moved their hospitals quite close to many of them to become close to baby-friendly. So we hope to see some major changes in Montana as a result of that. Another state that I'd like to point out as an example is West Virginia. West Virginia took the approach of, instead of providing the support directly through the state health department, they provided the funding to the West Virginia Breastfeeding Alliance, which was a great partner at that time. It not only allowed the West Virginia Breastfeeding Alliance to increase its own capacity because it had the extra funding, but it provided a way for the Alliance to work on its existing relationships, to work with hospitals and in the work site. And probably as big of a success was that both Montana and West Virginia have managed to leverage additional funds to increase their work. So in Montana, they built on the community transformation grants that came out of CDC and have continued their work transitioning out of our funding to the community transformation funding to continue the maternity practices work. And West Virginia, the Alliance used that as an opportunity to leverage funds from other sources, such as the Office on Women's Health, that provided them with a grant to work, to do additional work with maternity practices and work sites. And what's even more exciting for us is that our funding continues. So for the next 5-year cooperative agreement, which is that started in July 1st and goes through June 2018, we have $28 million, not for breastfeeding, but for several programs in this area. We have $28 million for a basic award that goes to all 51 states. This is primarily not targeted at breastfeeding, but building the state capacity to work in areas that have to do with obesity and chronic disease prevention. So building a base for other programs to be built on. In addition to that, we have awarded $40 million in what's called an Enhanced Competitive Award, and that was awarded to 32 states. Breastfeeding is a very strong requirement, it's very prominent in this particular project, and we have allowed the states to pick from a limited number of strategies. They can pick working in maternity care practices or working towards becoming baby-friendly. They can work in increasing employment support, support for employed women, basically helping employers put into place the federal requirements, And in addition to that, the states could also choose to work in peer and professional support or continuity of care, as we like to look at it. I can't tell you at this time which states have picked which strategies to work on, but their final work plans are due to CDC very soon, and once that happens, we can certainly make it known to our breastfeeding community what your specific states are working on with our funding. And I'm going to pass it over to Diane.
Okay, good afternoon. I'm Diane Roberts-Ayers, and I'm the project manager for our Community Breastfeeding Support Initiative. Last September, CDC provided one-time funding in the amount of $3 million to California, Indiana, Massachusetts, Michigan, New York, and Washington to provide funding to community-based organizations to establish breastfeeding support right after hospital discharge. So far, the six states have funded over 78 community-based organizations. And they're implementing support at hospitals, at breastfeeding clinics, baby cafes, and WIC clinics. Along with implementing those breastfeeding support clinics, all of the states that were funded have had additional support activities, such as training peer counselors and healthcare professionals, hiring lactation consultants, establishing lactation drop-in clinics and support groups, and developing continuity teams for sustainability. Some of the examples that we have is in Michigan, the state provided basic funding for basic breastfeeding training for their maternal infant health program staff, who are the ones who make home visits to at-risk moms and babies shortly after they leave the hospital. And they also provided training for cultural competency for healthcare providers. In Massachusetts, another example, they took a team approach and required each of their community-based organizations to develop a team that included members from the local hospital and from their WIC clinic to provide improve the continuity of care. And we look forward to sharing next year the evaluation of those projects. And now we have Doris.
Hi, I'm Doris Gross-Niklaus, and I'm the project officer for the Best Fed Beginnings project, which is our cooperative agreement with the National Initiative for Children's Healthcare Quality, also we refer to as NICHQ. The program helps hospitals use quality improvement approaches to implement the 10 steps to successful breastfeeding and achieve baby-friendly designation. This summer, the breastfeeding coalitions with Best Fed Beginning hospitals in their states have identified a liaison to reach out to a team member from the Best Fed Beginning hospital, and together they are identifying gaps in continuity of care in their communities and developing strategies to address these gaps, with the hope that there will be seamless transitions for the mother between the prenatal settings, the hospital experience, and then when they return home. This work is just getting started, and so we anticipate sharing opportunities and our learnings from this in the future. And our final regional learning session will be held in October. There will be a session in Cincinnati, one in New Orleans, and one in Phoenix. This will bring the hospital teams together. They'll share some of the learnings from their experiences in their individual hospitals, and then they'll be going home to work on the final activities that they need to be in line for baby-friendly designation. And NICHQ will continue to provide technical assistance to the hospital teams during the final year. And we are feeling that the hospital teams have made remarkable progress. You can see from this chart the progress they've made since July of 2012 to March of 2013. These are the measures that they are tracking every month and reporting to NICHQ, and you can see that they made improvements in both the process and outcome measures that we've been monitoring. And then finally, I wanted to give you a brief update about the mPINC survey. Our documentation is progressing through the necessary clearances with OMB and FSMA, which refers to the Information Security Act. so it will be nice and secure information. And we anticipate that the mPINC survey will be going in the field within the next couple of months. We'll be using the same process that we have used in the past for contacting hospitals. So we anticipate that the data collection will last about 6 months, and it'll take about 2 months to get through that initial screening contact. So if your hospitals call concerned that they haven't been contacted, it may be that they're just further down in the queue, and it might take a little longer for them to be contacted through our contractor who actually implements a survey. We've had over an 80% response rate for all the surveys thus far, and we hope that we'll have an increase and get an even higher response rate this year than in the past. And now I'll turn it over to Jessica.
Hello, everyone. We recently experienced here what I am calling Christmas in July. Not only did the breastfeeding report card come out on time and get a lot of great attention, but we also received the news that the CDC guide to strategies to support breastfeeding mothers and babies may be released. So this is a revision of the original 2005 guide, and we are currently in the process of getting it typeset and ready for the web and print. Looking at the list here, you can see a lot of these will look familiar, but there is one clear addition, and that is the section related to the support for breastfeeding and early care and education. To celebrate and culminate this release, we're going to be having a webinar launch event, and that will be on August 26th at 2 p.m. Eastern Time. And at this time, Dr. Luzhniak, who is the acting Surgeon General, is planning on joining us for this event. So we hope that everyone who is listening to this call will be able to listen in on that call. And we will use that time to answer a few questions about the guide, point out a few new items and resources, as well as give you some ideas on how to use it. I hope you can all join the call, and you will receive further information from USBC on how you may join the webinar event.
And as Jessica mentioned, we are very excited that this year the breastfeeding report card was able to come out on time, which was a huge feat from many, many hands, and Jessica was a huge, the main part of that, so we're thrilled that that happened. And we're very excited to be able to have the report card this year. As you know, most of you know, the first breastfeeding report card was published for World Breastfeeding Week back in 2007. And from the very beginning, we've always really thought of it as a tool that was for you, the coalitions and the state breastfeeding advocates. So knowing that you really are the primary users and audience for it, we've always tried to make it as useful as possible. So 7 years later, we're growing and we've expanded. So if you didn't get a chance to see it at the beginning of this month, if you were busy with your own World Breastfeeding Week and National Breastfeeding Month activities, here's what's in the new report card this year. As Larry mentioned, the newest rates are out, and we have really now come to use the report card as our main venue for releasing the newest NIS data. And in the most recent report card, we have the data from the 2010 births. So we've got a decade of breastfeeding rates, and we can see what's changed in at least the first three, which are the original 3 2010 goals. You may remember that we were able to add the exclusive goals at the mid-course review for Healthy People 2010. So we don't have those from 2000, but you're able to see, the real progress that we've made, and we almost made it on the 3 original ones. So the goal forever was 75%. For 6 months was 50. And the 12 months was 25. So very, very close. And as Larry pointed out, it only took us 20 years to get there, because that was also the goal for many years before then. But we're there. So this year's kind of cool because we've got this decade that we can look at, and we can anchor it to the 2010 progress. So we're glad to have that. You may have noticed that the formatting for the report card is different this year. So up until this year, we always had this 4-page spread that you could print out as one piece, and now we've expanded. And changing the formatting of the report card allowed us to dive deeper into some of the indicators in the report of breastfeeding support. And so we used this chance to expand the mPINC indicators, since we only get those every other year, as the whole mPINC score into 2 new ones. So now in this year's report card, we've got an indicator on skin to skin and an indicator on rooming in. And these are really cool because as you can see in the upper right-hand corner with the bar chart, we can see that we're improving on both of these indicators. So we're now to the point where more than half of hospitals across the U.S. say that most of their babies go skin to skin after vaginal birth within the first hour. And so, you know, the baby-friendly requirement. So that is very, very cool. And that's a huge leap. And remember, because this is a census survey, there is, you know, that is the actual number. It's not, you know, what's your confidence interval, et cetera. It's not a sample, it's a census. And the second indicator in that corner is rooming in. And that's also improving. So we're now up to the point where we've got more than a third of babies room in. In more than a third of hospitals, most babies room in for 23 hours a day. So lots of room for improvement. And as you can see in the map, on the rest of that page, there's also lots of room for improvement because we still have a huge variation across the country. There are some states that have really taken off with this. This is just an example of the rooming in indicator state ranges. So there's lots more that can be done on there. And then the last piece that I wanted to highlight from the new report card is another new feature, which is stories from the field. And I wanted to point these out because they all are encompassed in one page of the report card. And so if you need a quick and dirty, you know, snappy little vignette to be able to pass around to someone, you can print out, for example, just this page because it really crosses this huge range of activities. So these stories from the field highlight the indicators that are in the report card. We've got rooming in South Carolina, where one hospital in Greenville, the Greenville Health System, went from 10% to 90% rooming in 1 year, which is an awesome little story. Skin-to-skin care in Virginia, where they now have integrated into their routine care. Professional support in Indiana, which many of you have probably already heard of, but is still one of my favorites, where Walgreens has become really a hub for getting outpatient care, you know, getting lactation support and care, and really connected to the community. And then the last one is the integration of the lesson of child care activities into the child care centers that are for federal workers. So there's some really neat stuff going on, and we're hoping that we keep making this as useful as possible for you all. And with that, Larry's going to
wrap up with just a little bit about what's going on in the Federal Interagency Breastfeeding Workgroup. CDC chairs this group across federal agencies and federal departments. It was a call from the Surgeon General's call to action to create such an interagency work group. And so shortly after the call to action came out in January of 2011, we formed this group in May of 2011. We meet monthly by teleconference and have a face-to-face meeting twice a year, have representation from the Departments of Labor, Defense, USDA, Office of Personnel Management, and then a wide variety of different agencies within the Department of Health and Human Services. I won't go through all of them. They're all listed here, but probably all of the projects that you've heard about on breastfeeding over the last few years, those agencies continue to stay engaged in conversations about where we're going as a nation to support breastfeeding and bringing their own expertise and skills of their agency to bear. Just to give you a flavor of the kinds of things that we talk about when we meet on a monthly basis, here are just some of the projects that are going on in different parts of the government. I'm sure many of you have seen, hopefully all of you have seen, the new HHS campaign called It's Only Natural, Mothers Love, Mother's Milk. And we were part of designing how to disseminate that campaign and review it in its development. That campaign is focused on increasing initiation of breastfeeding among African American women with a particular focus on states in the Southeast. USDA has long had its Loving Support Makes Breastfeeding Work campaign, and they're in the process of revitalizing and revamping that campaign. And so we've been discussing as a group how to support that campaign. A new player in the group has been the Department of Defense, and they're really focusing on trying to get all of the military treatment facilities to become baby-friendly. It's not a significant commitment in the way that the Indian Health Service came out and said we were going to do this for all of them at once, but there are a number of facilities that have become baby-friendly, others who are in the process right now and are looking to ways that they can disseminate that across all military treatment facilities. We've been talking about breastfeeding issues and disasters, and there's a committee across HHS looking at the kind of guidance that we need for management of breastfeeding in disasters. The nursing breaks law, as you know, is the law of the land to provide accommodations for breastfeeding at the workplace for expression of breast milk. But many of the issues have been, how do people actually know how they can accommodate, how they can make these accommodations in their workplace? And so the Office of Women's Health has developed a series of videos and an interactive database online for employers to go to understand how they can become accommodating with this law. That's in its final stages of clearance and hopefully will be launched this fall. We have begun the process of creating a National Breastfeeding Research Consortium, which was also called for by the Surgeon General's call to action. This Breastfeeding Research Consortium is to bring researchers across the country in kind of setting the agenda for what kind of research needs to be done, to advocate for funding, to set standards for how breastfeeding research ought to be conducted in a consistent manner. We've had some difficulties with travel approvals at this point, so the group has not yet met, but we're hoping that that can come to pass sometime in the fall. We've been talking about trying to update the AHRQ's systematic review of health outcomes of breastfeeding. Nothing is decided on that, but it certainly has been a topic of our conversation. We're beginning to have conversations about the business case for breastfeeding and the tools that were created a number of years ago by the Maternal and Child Health Bureau, and what the process should be for updating those materials, how to disseminate them, what's the best way with the increasing use of the internet to actually make those tools most used. It just gives you a flavor of the kinds of things that we're talking about as a federal group. So that is our presentation for today. I hope it's been useful in this whirlwind tour of a wide variety of kinds of things that we do here at CDC and across the federal government. But I do believe that we have a little bit of time to fill in the gaps that we might have missed.
Thanks, Larry, and thank you, Larry. Terrific. Just so much great information to go through. I do have a few questions here, and there was one question about, can you all explain the new methodology in the collection of data with this year's NIS? I mean, are you using cell phones? Was there some question about that?
All right, wonderful question. I was going to put a little bit in there, and I thought, oh, it's going to get too confusing. I'll skip over it, but I guess people don't want me to skip over it. So the National Immunization Survey did begin sampling cell phones last year, or I guess, well, 2011, and then extended the cell phone sample in 2012. So there is the ability to use what they call a dual frame sample. So the sample includes both landline-only households as well as households that a cell phone-only household, as well as those that do have a landline. To maintain the comparability across the last decade, we opted this year to stay with the landline-only sampling. Now, because of that, it meant that the sample size was a little bit smaller for the statistics that we put out this year for the 2010 birth cohort. But we know that the methodology was completely consistent across all the years and how they sampled the households. We are in the process right now of investigating what the impact would be of including the dual frame, both sets of the sample, on the rates of breastfeeding. Theoretically, if the old way that we were doing the sampling worked in the ways that it was accounting for the underrepresentation of cell phone-only households through demographic indicators that were weighting it to the national distribution, through looking at households that had not had a landline in the recent past. The statistical weighting tried to bring this up to a truly nationally representative sample. If that was done correctly, then there would be no difference in the new way of sampling versus the old way of sampling. But as we know with statistics, things are not always perfect, and we're in the process of investigating, was there in fact some kind of a bias introduced by that process as we left more and more households who were cell phone-only households out of the sample. Our intention is that over the course of the next 12 months, we will publish a paper looking at the methodology change and what impact that would have on the rate. And then when we release the 2011 birth cohort next August, we will base that on the new full dual frame sampling and be able to give a few years of history on that on that sampling frame so that we can make our comparisons over time. So we'll kind of like start a new baseline next year.
Terrific. Thank you, Larry. There are a couple of short questions that I'm going to tell you, and then there is a longer one about State Breastfeeding Coalition. So one of them talks about the Walgreens and asks if Walgreens bills the insurers for the IBCLCs. Do you know that?
I think that's a great question to connect with Indiana about.
Yes. Does Walgreens bill for insurance for IBCLC services in Indiana?
Right, but I think the details of how they're implementing that program are probably better addressed by the folks in Indiana that are working on that program, because that's a very nuanced concept.
Mm-hmm. That makes sense.
What a great opportunity for coalitions to work together and talk.
And opportunities for coalitions to work together. There are a number of questions on this, and that refer to that although there's such a growing body of research on breastfeeding and our different national monitoring, we still know that there's significant knowledge gaps in the management and support of breastfeeding, and how are there ways in which CDC would help ensure that states that have received funding and instructions to take up breastfeeding strategies will partner with their state coalitions, so that efforts are not duplicated and the dollars are stretched. So a lot of the state coalitions have that question, not just for existing, but also for what might be some new opportunities that state coalitions might do to be able to build this base and take opportunities for funding by CDC and other sources and address this knowledge gap.
I'm not quite sure. There was a lot in that question, Kinkini. Was there a question at the end of it, Kinkini? I think we're all looking at one another a little bit confused. Are you there, Kinkini?
Oops. I was muted. Sorry about that. So I've been talking to myself. So the question was, what could CDC do to help ensure that states that have received funding and instructions to take up breastfeeding strategies will partner with their state coalitions? And a couple of the state coalitions that have written have said that in my coalition, our State Department has proposed various activities. How do we collaborate better, streamline our efforts better? So will there be any guidance from CDC to include state coalitions?
Joe, you want to start on that one?
Yeah, I think the key word here is opportunity. The funding that just went out to the states is brand new. I will caution you that the states got less than they thought they were going to get, so that's why they're in the process of redoing some of their plans, but they still have to address breastfeeding. I know from our perspective as project officers for the states, we are encouraging the states to make sure that the breastfeeding coalitions are part of their larger partnership. But I do also think that this is a really great opportunity for the coalitions to take on a leadership role and really work on building their relationship with not only the state health department, but the partners that are partners of the state health department, so they become a part of that bigger, broader, horizontal group of folks that are trying to address chronic disease prevention in general. And then the other thing that I would say is, don't forget that in 2014, there's going to be a coalitions conference, and that'll give us all a great opportunity to talk about the funding that went out and how the states that are working with our coalitions are doing it well, and what other coalitions how they can, and that other coalitions can network with the ones that are doing it well to find out what the secrets to their relationship building have been. If there are any individual concerns with particular states and building that relationship, Diane and I are open to receiving calls from you because we have connections to all the project officers, and we can certainly step in and help with that.
The other thing I might mention on that, Carol, before we move to the next question, is the importance of communication. You know, oftentimes these funds are going to go to the chronic disease department, and the project officer may be the chronic disease director for the state. And it's important that the Breastfeeding Coalition communicate with the state health department on what they're capable of, put forward their best ideas, how they really can move something forward. The states are looking for good, workable, implementable projects that they can dive into immediately. And if you sit on the sidelines waiting for them to come to you, they may never come to you. But maintaining that dialogue, what they're interested in, what you can offer to them, great projects that you've got, I think is the best way to build this larger and larger over time.
Yeah, I agree with that, Larry. And also keep in mind that every state structure is a little bit different. So you'll have a state where there's an internal breastfeeding group working across programs, but you'll have another state where the chronic disease section sits in a completely different building or even in a completely different city from where, say, the WIC program sits, and there hasn't been much communication in terms of how the two relate together. So part of that relationship building and communication may also involve your insight into bridge building in terms of how breastfeeding applies to chronic disease prevention.
Thank you. That's really helpful. And as we say, at USBC, we've been working, and we will be, with the needs assessment, getting a lot of priorities from our state coalitions, but really working to build their capacity to nurture these partnerships, to be able to communicate, so when the opportunities come up, they really are primed and ready to take advantage for all the work that they do. So the next question is there any discussion of a universal method of collecting data from baby-friendly hospitals and hospitals collecting breastfeeding data for Joint Commission core measures? And how will that data compare with the immunization NIS breastfeeding data?
I think that's a two-part question, and I might actually see if Amelia is on the line to address the first one, because I think she's really at the hub of all of those work on Joint Commission measures and how to build that into EHRs. So Amelia, you want to take the beginning of that?
Sure. So first of all, I would direct everyone, if you haven't seen it yet, make sure you go on to the USBC website, and under the healthcare section you can find a toolkit that helps with implementation of the Joint Commission's perinatal care core measure set. That's a really great start. From there, I would just assure everyone that on the electronic health record side, there is an expert panel that has been convened under the NICHQ funding that is working on recommendations on exactly how to implement an exclusive breast milk feeding measure within the hospital. And the guide will inform both the healthcare providers and software vendors, and that will be coming out in the fall. Is there another portion to the question?
I think the second part of the question was a little bit more for CDC about how will we ensure that there's consistency between the NIS statistics that we really use as our main method for tracking over time with these measures coming out of the hospitals. And it's a difficult challenge. We have very different methodologies. What's done on the EHR is based on feed-by-feed charting of what's going on in the hospital, whereas NIS is based on taking mothers who are about 2 years postpartum on average and asking them retrospectively what did they do, how long did they breastfeed. And certainly in a perfect world, those two would line up fine with one another, but we know that there are recall issues that aren't perfect, interpretations of what happened at different points in time. We do know from some of our focus group work and our cognitive interview work on these questions that mothers often forget exactly what happened in the hospital, or they don't think it's necessarily relevant when they're talking about over a long period of time. And so we do understand that when we look at our rates of formula supplementation in hospital, those are probably biased estimates, and they probably are an underrepresentation of how much supplementation is actually going on. So we're going to have two different systems with two different measures, and I think over time we'll continue to look at how these two compare to one another.
Terrific. Thanks, Larry. And another question on who coordinates the Federal Interagency Breastfeeding Workgroup. Is CDC the coordinating agency?
Yes, CDC is the coordinating agency.
Okay. And we got a lot of questions, again, addressing that gap in management and support of breastfeeding. How could we better educate our pediatricians? How could we make sure that, if there's jaundice or if there's latch on or that they don't, that supplementation stops. And I know that a lot of your work of the projects is around education to some of the community and state projects, right, Larry?
There are a lot of different pieces to that. Certainly a traditional role in the Maternal and Child Health Bureau has been physician education, and we are beginning conversations with them as they've kind of had a changeover in staff of building up more of that. There's also the Bureau of Health Professions at the HRSA that's separate from MCHB, and we're talking with them about ways to increase education of physicians and nurses. But there are many different health professionals that we're trying to reach through multiple different channels.
Yeah. Thank you. And I think that kind of covers a lot of the questions we got regarding this. We do have some other questions that we will be addressing because they're outside the realm of this panel. So thank you again so much for this wonderful presentation. Is there anything else, Larry, that you wanted to say that you didn't get a chance to say? We have about a minute before we get into some of the other updates.
I just want to thank the coalitions for their ongoing work in this area and let them know that we're always open to more feedback on the products that we've created, on the aspects of breastfeeding that you think that we could be working on. As you can see, we cover a wide spectrum, and we don't always have all the staff time that we would like to be able to add on more and more activities, but if we don't know what your needs are, we certainly can't address them. So please keep up the communication, funnel your questions and your issues through USBC, through your project officers, through the State Health Department, or just send emails directly. We're always open to hearing your ideas. Thank you for the time to share today.
Thanks very much, Larry. And so moving on to our next session, as Jessica already mentioned, that we will have a special webinar to launch the updated Guide to Breastfeeding Interventions, and that will be on Monday, August 26th. Stay tuned for an announcement and registration information for that. And then, so with this being National Breastfeeding Month, we have teamed up, USBC has teamed up with Moms Rising, National Partnership for Women and Families, and the National WIC Association to launch the 2013 Breastfeeding Month campaign. And this campaign is focused on a weekly topic, and so you can look at this at the slide and see that the first August 4th through 10th we focused on the peer counseling. This week is paid family leave, and then August 18th through 24th we will be doing a lot of advocacy on maternity care practices, and then 25th through 31st on employer support. You can again find a lot of information on our website at www.usbreastfeeding.org/NBM, and you get a lot of easy action tools as well as templates to promote the campaign in your social media networks. I wanted to give a quick update on the state coalition needs assessments. So we've had, as you all know, that we've had this two-part with the member and leader online surveys and phone interviews. So thank you all for the time and responsiveness to the assessment. Almost all state and territory coalitions have completed this surveys as well as the group phone interviews. If you are one of those that haven't, you still have time to participate. So now the USBC Coalitions Committee is working with the USBC staff to develop a feedback matrix that define the markers of effective coalitions at different stages. And once this template is complete, we will use your responses to create a customized report for each state. So the plan is that this tool, this feedback tool will serve as a guide for USBC and state territorial coalitions to communicate about current and future growth and needs for technical assistance. So for the many of you who've been, bombarded with emails and phone calls from me, it's been a wonderfully rich experience to get to know the state coalitions through this process, and I will continue to work with all of you as we develop this feedback tool. And another thing that we are doing is, while we've been hearing loud and clear from you that you really would love some USBC support on coalition building. So while we are working on our customized plan for you, we will be working on a webinar series called Power Tools for Coalition Building. And we have we want to respond to the needs, the priorities that you highlighted for us through our conversations. So we want your feedback, but these are some topics that we will be wanting to have monthly webinars on: governance 101, 201, bylaws, policy structure, how to convene community stakeholders, and really grow our coalitions into cross-disciplinary, multi-stakeholder entities, how to do some strategic planning, how to use data, fundraising, grant writing. So I have an ask from you. In the evaluation that's going to be sent out to you in a couple of hours, we have listed these topics and we've asked you to rank them in order of your importance. And so we really want to hold these webinars based to address the most urgent ones first. So you get a chance to rank them, and we will be selecting the topics that are most voted by our listeners. So the first webinar in this series will be on Tuesday, September 10th at 2 a.m. Again, we'll send an announcement for that. So we are gearing up for the 2014 Coalitions Conference, which will be from August 2nd through 4th in Washington, D.C. And again, this program, the conference program, will be informed by our needs assessment. You all have been very clear about what your needs and priorities are, and we want to make sure that we bring you a conference that really addresses that. The other thing will be that our significant priority will be on equity and making sure that that coalitions look at their impact and outcomes through the lens of health disparities. So this priority will be a significant influence on our program design, so that all coalition representatives leave the conference with an understanding of the role of coalitions in ensuring that all families have access to quality breastfeeding support and success. And so with that, we are right on time to adjourn, and thank you all again for for attending this really special session. For the regional calls, if you're one of the 5 for your state connecting to the regional call, please disconnect from this line and dial into your regional numbers. Your evaluations will be sent, so please do send us your evaluations and let us know how to plan our Power Tools for Coalition Building webinar series. We need your help on that. So thanks for all you do. Thank you.
Thank you, Kinjini.